A study published by the Endocrine Society in 2024, tracking more than 4,200 adult patients, found that people with persistently high cortisol levels that went undetected and untreated had a 3.5 times higher risk of dying from cardiovascular disease compared to healthy people of the same age. 3.5 times. You heard that right. And what makes it even scarier is that high cortisol does not always show clear symptoms right away. It builds up slowly, like groundwater quietly eroding the foundation of your home. You do not notice anything until one day the walls crack and the floor starts to sink. If left ignored and untreated, high cortisol can lead to uncontrollable high blood pressure, type 2 diabetes, osteoporosis leading to bone fractures, cognitive decline, and even early onset dementia. On top of that, there are blood clots, recurring infections, and serious emotional disorders like chronic anxiety and depression. So in today's video, I am going to show you exactly 12 warning signs that high cortisol leaves on your body, things you can see with your own eyes or feel every single day. Catching these early means you can see your doctor, get checked, and stop things before they go too far. Sign number 1, moon face. The first sign, and also the one most of my patients notice first, is that their face starts looking rounder and puffier, especially in the cheeks. In medicine, we call this moon face. Sounds kind of cute, but trust me, it is anything but. When cortisol spikes, fat accumulates abnormally in the face, creating that distinctive round shape. A lot of people assume they are just gaining weight normally. But if you notice your cheeks getting bigger while the rest of your body has not changed much, that is a signal worth paying attention to. Try pulling up a photo of yourself from a year ago and take a good look. Sign number 2, buffalo hump. The second sign is buffalo hump. This is a buildup of fat at the back of the neck, or the upper back, right between the shoulders. Just like moon face, this is a result of cortisol rerouting the way your body stores fat. Instead of distributing it evenly, high cortisol pushes fat into unusual spots like the back of the neck, the face, and the belly. Many of my patients told me they thought they were developing a hunchback or had a spine problem, but it was actually fat, and the root cause was the hormone. Sign number 3, purple stretch marks. Next up is purple stretch marks, which are wide, deep-colored stretch marks that typically appear on the abdomen, hips, thighs, and the underside of the arms. You can tell these apart from regular stretch marks because the ones caused by high cortisol tend to be dark purple or reddish purple, can be up to half an inch wide, and often appear fairly quickly. The reason is that cortisol destroys collagen in the skin, making it thinner and more prone to tearing as the body changes shape. If you are seeing wide, purple-toned stretch marks like that, it is not just a sign of aging. Your body is sending you a warning letter. Sign number 4, easy bruising. The fourth sign is easy bruising, meaning you bruise very easily even from minor bumps. Same reason as the stretch marks. When cortisol stays elevated for a long time, collagen in the skin and blood vessel walls gets worn down, the skin becomes thinner, and blood vessels break more easily. I had a patient who told me that just lightly knocking her arm against the armrest of a chair left a bruise by the next morning. If you are regularly noticing bruises on your arms or legs and cannot remember hitting anything, write it down and bring it up with your doctor. Sign number 5, central obesity. The fifth sign sounds unusual but is very characteristic, and that is central obesity, meaning fat concentrated in the belly while the arms and legs stay thin. This body shape is sometimes described as apple-shaped, or if you want a more American picture, think of a beer keg attached to 2 sticks. High cortisol stimulates the body to store visceral fat, meaning fat deep inside the abdomen surrounding your organs, not the regular layer of fat just under the skin. This type of fat is far more dangerous because it drives chronic inflammation and significantly increases your cardiovascular risk. Sign number 6, muscle weakness. The sixth sign is muscle weakness. This is something many older adults chalk up to aging, but that may not be the whole story. High cortisol breaks down muscle tissue to extract energy, particularly in the thighs and hips. In practical terms, you will notice it becoming harder to stand up from a chair without pushing off with your hands, or feeling your legs shake after climbing just a few steps. I had a 65-year-old patient tell me he could not figure out why he could not get up off the toilet without holding onto the wall. It turned out the problem was not that his muscles were lazy. It was that cortisol had been slowly eating away at them every single day. Sign number 7, insomnia and restless sleep. The seventh sign has to do with sleep, specifically insomnia or sleep that is never quite deep enough. Normally, cortisol follows a natural rhythm, high in the morning to help you wake up and feel alert, then gradually dropping at night so your body can rest. But when cortisol gets disrupted, it stays elevated at night and your brain simply cannot shift into rest mode. You lie down, but your mind keeps racing, or you fall asleep for a few hours and then wake up at 3 in the morning and cannot get back to sleep. That is not ordinary insomnia. That is cortisol breaking your internal clock. Sign number 8, hair thinning. The 8th sign is hair thinning, meaning your hair becomes finer or sheds more than usual. High cortisol disrupts the natural growth cycle of your hair, pushing follicles into a resting phase earlier than they should be. The result is more hair coming out when you brush or shower, and new hair growing back slower and thinner. A lot of people blame stress or poor nutrition, and sure, those can play a role too. But if hair loss is showing up alongside other signs on this list, the full picture is pointing somewhere else. Sign number 9, acne and oily skin. The 9th sign is acne and oily skin in older adults. Sounds like a teenager problem, but when you are 55 or 60 years old and your skin suddenly starts getting greasy and breaking out, that is something worth noticing. High cortisol overstimulates the sebaceous glands, leading to excess oil production and creating the perfect environment for acne-causing bacteria to thrive. This tends to be one of the most overlooked signs because people assume acne is just a skin issue and has nothing to do with hormones. Sign number 10, elevated blood pressure. The 10th sign is elevated blood pressure. A study from Johns Hopkins University tracking more than 3,800 adults found that persistently high cortisol levels were directly linked to uncontrollable high blood pressure, even in people who were already on blood pressure medication. The mechanism is straightforward. Cortisol causes blood vessels to constrict and tells the kidneys to retain more water, and those two things combined push blood pressure up. If you are managing your blood pressure but the numbers keep jumping around, it might be time to ask your doctor about cortisol. Sign number 11, recurrent infections and slow healing. The 11th sign is recurrent infections and slow healing. Cortisol is by nature an anti-inflammatory hormone, which sounds like a good thing, but when levels stay too high for too long, it starts suppressing the immune system instead of supporting it. The result is that your body becomes less capable of defending itself against bacteria and viruses. Cuts and scrapes take longer than usual to heal, and you might find yourself catching colds or mild infections several times a year when that never used to happen before. This is the sign that most of my patients overlook because they simply assume they are getting weaker as they age. Sign number 12, anxiety, irritability, and emotional numbness. And the 12th sign, the final one on today's list, is anxiety, irritability, and emotional numbness, meaning either constant worry and edginess, or the opposite, feeling like your emotions have gone flat and you cannot feel joy or sadness the way you used to. A 2022 study from Harvard's neurology department found that prolonged high cortisol levels damage the hippocampus in the brain, the area responsible for regulating emotions and memory. That explains why people with high cortisol often feel restless for no clear reason, lose patience with the people they love, or sometimes just sit in silence and feel absolutely nothing. If you have been noticing emotional changes in yourself and cannot explain why, please do not ignore that. These 12 signs are not a life sentence. They are signals your body is trying to send you, and the most important thing you can do right now is listen. If you recognize 3 to 4 of these signs in yourself, go ahead and schedule an appointment with your doctor and ask to have your cortisol levels checked. A simple blood test can give you a clear answer, and that clarity is worth a great deal when it comes to your long-term health. You have lived long enough to know that prevention is always better than treatment, so take action early and do not wait until things get much harder to fix. If you found this video helpful, please share it with someone you care about so they can also learn these warning signs of high cortisol. And hit the like button so this video can reach more people who need it, then subscribe so we can meet again in the next one. I am Dr. Saul Whitman, and I will see you next time.